from your organs. We need to check the connections, the wiring system. Is that making sense to you guys? Very good.
Yeah.
Okay. A spleen. Okay. You all saw where the spleen lives. The spleen lives here. Okay. If you have a problem in the spleen is the main organ of your immune system. It releases T cells, B cells, lymphocytes, macrophages, all these scavengers, the soldiers that eat up all the infections in the system. So if a spleen has pain here, or is enlarged or it's not functioning properly, it could refer pain here, it could refer pain there. Pancreas. People have pancreatitis. You've heard of this, huh? Inflammation of the pancreas. All right? Itis. All itis is inflammation. Itis. I mean, you can say wallitis, something, whatever it is. Everything is inflamed. But bottom line is that if the pancreas is inflamed, how many people you've seen walking like this? Right? When you have pain in that organ, and it becomes very, very debilitating. And on and on. A small intestine, bladder, gallbladder. Okay? Gallbladder. Liver, lungs, etc. So, some of your pains could be coming from your organs. You need to understand, and the world needs to know that not all pains, well, it's my elbow. What's wrong with it? Did you fall? That's what patients tell me. Doc, I have a pain in my elbow, for example. Okay, did you fall on your elbow? No. Did you hit your elbow hard? No. Did you, hit your elbow on the wall? No. So, where is the pain coming from? Good question, right? Mm-hmm. We need to track the highways, the nerves, okay, and see if it's an organ problem, if it's a brain problem. It becomes very, very intricate and very delicate and precise, all right? Let's move on for a second here. So, now, we look at the brain again, okay? Watch. This is the brain, and this is the brainstem. You know, it's the extension of the brain. So all your brain, and this is the cerebellum that gives you your balance, does more than that, but let's keep it simple at that. So, if connections in the brain are not firing properly down your spinal cord and connecting to all your organs, now organs are in trouble. Possible symptoms of visceral malfunction. What are the possibilities? You might have these symptoms if your organs are not firing properly. Migraine headaches. How many people have migraines? Millions, over millions. And what do they take? Millions of pills. Okay? Throat constriction, neck, shoulder, arm, back, leg pain or weakness. How many people have that? Tons, truckloads. I mean, horrible. Difficulty breathing, okay? Stiffness, arthritis, look at this. And on and on and on. Frequent colds, chronic cough, sinus, overweight. Ladies and gentlemen, listen to this. If your organs are neurologically malfunctioning, you cannot lose weight. Or, let me say it differently. You lose weight, and when you eat something, welcome back all the weight you've lost, and you've been trucking to lose it for 1 year. And you deprived yourself of whatever it is. You can't do that. You need to enjoy life. All right, so the list goes on. Brittle nails. How many of you have this? Patients come and tell me, Dr. Jody, look at my, I mean, why is my nail cracking? It's important, right? Skin wrinkles, sagging skin. Okay, I mean, we all maybe have this or coming to it or whatever it is. And sometimes we get it at early age that we shouldn't get it, like 40 years, 50 years. We shouldn't. And then how many of you or how many do you know have this? No one likes it, right? It's degeneration, infection, it's toxicity. The cells are dying by billions, okay? Muscle and joint pain, dizziness, vertigo, loss of balance, heartburn, we already talked about it, chest pain, bleeding, heart problems, food allergies, personality changes. People who have digestive disorders, they're irritable. Don't talk to me. They're grouchy. Okay, it can destroy lives. They don't want to be that. Fluctuation in temperature. How many people you've heard, Dr. Jody, I'm freezing all the time. It's 120 outside and I am in the freezer. I'm freezing. Why? Because the brain, the hypothalamus, is not regulating temperature in the brain. Hormonal imbalance. I mean, you've heard this all the time. Fatigue, irritability, anemia, sugar cravings. Dr. Jody, if I don't have my chocolate or my ice cream, I wanna destroy 5-6 people. I wanna kill them. Okay? I want my chocolate. I want my sugar. Addiction. Okay? Addiction. Alcohol. Okay? Unusual discharges. On and on and on. Okay? Decreased libido. Dr. Jody, my marriage is at stake. Okay? If I don't do anything about this libido, my husband is firing me. Okay? Gone. Or something. It's horrible. It can destroy lives. Menstrual depression, anxiety, a feeling of impending doom. Patients come and tell me, Dr. Jody, the world is closing on me. I don't know what to do. And I know that these words hit most of you and hit listeners out there because I know that they have these conditions. I know very, very well because I see it every day. A major complaint I heard all over. Loss of quality of life. And in some instances, loss of life. You leave these things, you don't do anything about them. Your life will be lost. You don't want to do that. Take action, take control, do something better. Okay? Answers are at hand. Okay, why is the brain-gut connection essential? Why is that? Good question, right? Okay. To establish, number one, neurological communication between the brain and the organs. Don't you want to establish that? Don't you want to know if the liver is firing to the brain through the connections we talked about earlier? You want to do that. Maintain organ viability and function. Organs should be viable and functioning very, very well. You should eat something, digest. You don't want to eat something and you feel, okay, now I'm going to go to bed for 4 hours or 5 hours because I ate something. You don't want to do that. It's important, brain-gut connection, to increase circulation and organ motion. It is important. Increase cellular communication. Cells need to communicate. They can't communicate without viability and neurological connection, without coordination with the brain. Increase metabolism. Many, many patients come and tell me, Dr. Jody, and we addressed this in the first question, I eat like a bird. Look at me. Look at me. I'm gaining weight. I'm not eating nothing. Or I eat 300 calories a day. What do you think? Is that good? Give me a break. Please, don't fall into these traps, okay? You need to eat and digest. You need to be burning machines. Not you eat something and you're stagnant for 1 week. This means something is not functioning properly. Restore homeostasis. What does that mean? It might be a fancy word to you. The homeostasis means a balance between in the autonomic nervous system and your autopilot, sympathetic, parasympathetic. It should be balanced inside. Okay? This means things should be firing back and forth in a good direction. Okay, let's continue here. Why is it also essential? Look at this. Prevent or reduce scar tissue formation. How many people had surgeries, C-sections, organ removal, accidents, scar tissue, stitching? Okay? We do specific work on that in order to reduce the scar tissue and increase circulation. Okay? Increase lymphatic circulation and drainage. You should be, eliminating. Increase inner organ motility. And so you see how many things are important for the brain-gut connection. Many, many things. Prevent abnormal spinal curvatures. We have patients here in the room with us that have this problem. People, you see them walking like this. What happened? Oh, my doctor told me it's genetics. Yeah, I have a genetic problem, doc. How do we know? The doctor was in your mother's womb. How do we know? Okay, it's just an assumption. We are assuming. If they don't know anything what that is, they tell you it's genetics. All right, and you feel, okay, well, I'm hit with that genetics thing. Okay. Prevent abnormal spinal curvature which precede organic visceral diseases. Organ becomes spastic because it's not working. It puts you in a twist because it's connected. Why? Why does it put you in a twist? It's connected to your ligaments, your nerves, your muscles. Everything is one piece. There is no disconnection here. The world needs to know that we are all glued together. There's no disconnection. Well, I'm going to treat your liver. I have nothing to do with your pancreas. This guy lives on its own. No, no. Maintain a balanced gut environment conducive to proper function, digestion, and elimination. That's why brain-gut connection is essential. Okay? Where do we start after all this? Based on individual patient presentation. So patients come into our office. Where do we start? Someplace, huh? The first thing, we do a comprehensive brain-based examination. Comprehensive. Takes about 45 minutes to 1 hour. And most of you who are patients know that for a fact. Correct? Okay. Second, based on the patient presentation, we do a functional chemistry analysis lab diagnostics. We need to know what's going on with your liquids, your stools, blood pH, urine, adrenal stress index, saliva pH, heavy metal testing, and other chemical or electrolyte tests. We need to know what's going on besides the neurology. We need to know the chemistry if things are off. So we do all types of functional testing. In other words, let me make this clear and simple. We look at the ranges that are functional. This means that you should be functioning, let's say, between 55 and 65. Now, we do not want to wait until you are 120 off or something in that number, because you will have a disease. Okay? We do, when needed, MRIs, CT scans, Dopplers, and other advanced imaging to determine if there is any tumor, any whatever is going on, okay, anything there. And we have developed a unique approach. What is it? We gather all the data, we study it, we assess it, going into the root of the problem. And we put an individualized, focused treatment plan for every single patient. No one-size-fits-all presentation. Everyone has something. Would you all agree? Some of you are my patients. Do I do the same on each one of you? No, absolutely not. Which consists of 4 things. Specific brain-based applications. Pre- and post-ganglionic assessments. Doing what? Looking at organ malfunction. Devised and balanced nutritional plan. We tell you what to eat, what to do, how to maintain a functional, strong lifestyle. We don't tell you, oh, okay, I'm going to lose weight. Don't eat, or eat rice for 3 weeks. Lab, diagnostic, interpretation, and analysis to figure out what's going on. And above all, ladies and gentlemen, and this is very, very important, and you know this, we take time to listen to you and address your condition thoroughly. Is that correct?
Yes.
Yes. Okay, we appreciate that, because you are very, very precious to us and to you. Our approach is unique because it's a groundbreaking new understanding of digestive disorders. It's groundbreaking. It's a new understanding. How many times you've heard this? Honestly, anybody heard any doctor talking about these digestive disorders like this? No, because they tell you, okay, your liver is not working. I had a patient of mine, 77 years old, true story. Came in constipated. He's been constipated for 3 days. Went to his doctor. Doctor looked at him. That's exactly what happened. This is the patient telling me, and he gave us a testimonial. He said, he didn't look at him. He said, is your name so-and-so? Yes. He says, okay, your colon doesn't work. We're going to give you something. In 1 week, if your colon doesn't work, we're going to take it out.
Colon take it out.
Think about it, ladies and gentlemen. Think about you in that position, in that patient's shoes. I mean, just by the doctor telling you this, your colon will not work. Even if it's working, this is a lot of stress. It's horrible. Okay? So, okay, this is non-invasive and non-pharmaceutical approach. Very important. We don't give you drugs, or we don't do incisions, or we don't do injections. You all understand this. Ladies and gentlemen, health is a choice. It's a choice. I mean, no one forces you. Hey, I'm sorry, your name, ma'am? Again.
Rita.
Rita, you need to be healthy. Yes, yeah, by force. No, it's a choice. You make a choice, okay? Nothing is by force. So please, please, and for the whole world, take control of your health. Life comes once, not twice. You're gonna enjoy it well. Thank you for listening.